Question 1. Governance review demonstrates that an FNP is counseling a patient regarding a reproductive system disorder. The patient expresses a strong preference for a treatment option that is not considered the first-line, evidence-based approach and has potential risks that have not been fully explained to the patient by previous providers. The FNP must determine the most appropriate course of action. Which of the following approaches best aligns with FNP scope of practice and ethical guidelines in the United States? Option A. Proceed with the patient's preferred treatment option without further discussion, as the patient has expressed a clear preference. Option B. Thoroughly educate the patient on all medically sound treatment options, including the risks and benefits of the evidence-based first-line treatment and the patient's preferred option. Explore the patient's reasons for their preference and offer continued support in decision-making. Option C. Focus solely on the risks associated with the patient's preferred treatment option to dissuade them from pursuing it. Option D. Immediately dismiss the patient's preferred treatment option as inappropriate and insist on the evidence-based first-line treatment to ensure patient safety. Correct answer is B. Thoroughly educate the patient on all medically sound treatment options, including the risks and benefits of the evidence-based first-line treatment and the patient's preferred option, explore the patient's reasons for their preference, and offer continued support in decision-making. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the FNP to navigate a complex interplay of patient autonomy, potential risks associated with a reproductive health decision, and the legal/ethical obligations to provide accurate, unbiased information. The FNP must balance the patient's right to make informed choices with the responsibility to ensure those choices are based on a thorough understanding of all available options and their implications, particularly when the patient expresses a preference for a less evidence-based or potentially harmful approach. Correct approach analysis. The correct approach represents best professional practice because it upholds the core ethical principles of beneficence, non-maleficence, and patient autonomy, all of which are foundational in FNP practice under U.S. regulatory frameworks. Specifically, it aligns with the American Nurses Association ANA Code of Ethics, which emphasizes the nurse's duty to advocate for patients while providing comprehensive education and support for informed decision-making. This approach ensures the patient receives accurate, evidence-based information about all medically sound options, including potential risks and benefits, allowing them to make a truly informed choice. It also respects the patient's right to self-determination, even if their initial preference deviates from the FNP's recommendation, by offering continued support and exploring the underlying reasons for their preference. This aligns with the principles of shared decision-making, a cornerstone of modern healthcare. Incorrect approaches analysis. An approach that immediately dismisses the patient's stated preference without thorough exploration fails to respect patient autonomy and may violate the principle of non-maleficence by potentially alienating the patient and hindering their engagement with appropriate care. It also risks imposing the FNP's values on the patient, which is ethically inappropriate. An approach that solely focuses on the patient's stated preference without providing comprehensive, evidence-based information about alternative, medically recommended options is a failure of the FNP's duty to educate and promote informed consent. This could lead to a patient making a decision based on incomplete or inaccurate understanding, potentially resulting in suboptimal health outcomes or harm, thus violating the principle of beneficence. An approach that involves pressuring the patient towards a specific treatment option, even if it is the FNP's preferred evidence-based choice, crosses the line from education and recommendation into coercion. This undermines patient autonomy and can erode trust in the provider-patient relationship, violating ethical guidelines that mandate unbiased counseling. Professional reasoning. Professionals should employ a decision-making framework that prioritizes patient-centered care. This involves active listening to understand the patient's concerns and preferences, providing clear, unbiased, and evidence-based information about all viable options, exploring the rationale behind the patient's choices, and collaboratively developing a care plan that respects the patient's autonomy while ensuring their safety and well-being. When faced with a patient's preference that differs from evidence-based recommendations, the process involves open dialogue, education about risks and benefits of all options, and a commitment to supporting the patient in making the best decision for themselves, even if it requires further exploration and counseling. Question 2. Implementation of a comprehensive contraceptive counseling session for a new patient seeking long-acting reversible contraception. LARC requires the family nurse practitioner, FNP, to assess the patient's understanding of various LARC methods, discuss potential side effects and contraindications, and collaboratively determine the most suitable option based on the patient's individual needs and preferences, while adhering to current evidence-based guidelines and state regulations. Which of the following approaches best exemplifies this implementation? Option A. The FNP presents a brochure on LARC methods and asks the patient to choose one, stating that all LARC methods are equally effective and have minimal side effects. Option B. The FNP focuses solely on the patient's stated preference for a specific LARC method, prescribing it without further discussion of alternatives or potential risks to respect the patient's immediate desire. Option C. The FNP immediately prescribes an etenodistral implant, as it is a highly effective and commonly used LARC method, assuming it will be suitable for most patients seeking long-term contraception. Option D. The FNP provides a detailed overview of all available LARC methods, including their mechanisms of action, typical efficacy rates, common side effects, and potential contraindications, then engages in a discussion with the patient to explore her lifestyle, reproductive goals, and any concerns, ultimately recommending a method that aligns with both clinical appropriateness and patient preference. Correct answer is D. The FNP provides a detailed overview of all available LARC methods, including their mechanisms of action, typical efficacy rates, common side effects, and potential contraindications, then engages in a discussion with the patient to explore her lifestyle, reproductive goals, and any concerns, ultimately recommending a method that aligns with both clinical appropriateness and patient preference. Explanation. This scenario presents a professional challenge due to the FNP's responsibility to provide evidence-based, patient-centered care within the established regulatory framework for women's health services. The core of the challenge lies in balancing patient autonomy and informed consent with the FNP's duty to provide accurate, comprehensive, and safe care, particularly concerning reproductive health decisions. Careful judgment is required to navigate potential conflicts between patient preferences and recommended clinical guidelines, ensuring that all care aligns with the FNP's scope of practice and relevant state or federal regulations governing healthcare provision. The correct approach represents best professional practice because it prioritizes a thorough assessment of the patient's individual needs, medical history, and personal circumstances before recommending a contraceptive method. This aligns with the ethical principles of beneficence and non-maleficence, ensuring the chosen method is safe and effective for the patient. Furthermore, it upholds the principle of patient autonomy by providing comprehensive counseling on all available, appropriate options, empowering the patient to make an informed decision. This approach is directly supported by the American Nurses Association, ANA, Code of Ethics, which emphasizes the nurse's role in advocating for patients and ensuring they receive accurate information for decision-making. It also adheres to the guidelines set forth by professional organizations like the American College of Obstetricians and Gynecologists, ACOG, regarding contraceptive counseling and management. An incorrect approach that involves immediately prescribing the most commonly used, or the FNP's preferred method, without a thorough assessment, fails to uphold patient autonomy and informed consent. This constitutes an ethical failure by potentially overlooking contraindications or patient-specific risks, violating the principle of non-maleficence. It also represents a regulatory failure if it deviates from established protocols for contraceptive counseling and prescription, which mandate a comprehensive evaluation. Another incorrect approach, such as dismissing the patient's expressed concerns about a particular method without adequate investigation, demonstrates a lack of respect for patient autonomy and can lead to suboptimal care. This is an ethical failure in communication and patient engagement. Finally, an approach that relies solely on outdated clinical guidelines or personal experience, rather than current evidence-based practices, is a professional and potentially regulatory failure, as FNPs are expected to practice according to the most up-to-date standards of care. The professional decision-making process for similar situations should involve a systematic approach. First, conduct a comprehensive patient history and physical examination, including a review of past medical history, current medications, allergies, and reproductive health history. Second, engage in open and honest communication with the patient, actively listening to her concerns, preferences, and values. Third, provide thorough, unbiased education on all medically appropriate contraceptive options, discussing their efficacy, risks, benefits, and side effects. Fourth, collaboratively develop a care plan with the patient, ensuring she understands the chosen method and how to use it effectively. Finally, document the assessment, counseling, and decision-making process meticulously, adhering to all relevant state and federal regulations and professional ethical standards. Question 3. The assessment process reveals a patient reporting significant fatigue and generalized weakness, yet the physical examination findings are largely unremarkable, with normal vital signs and no palpable lymphadenopathy or organomegaly. The patient also expresses concern about their ability to perform daily activities. Which of the following approaches best guides the FNP's next steps in managing this patient? Option A. Prescribe a stimulant medication to address the reported fatigue, assuming it will resolve the patient's symptoms. Option B. Focus solely on the normal physical exam findings and conclude that no further assessment or intervention is necessary at this time. Option C. Reassure the patient that since objective findings are normal, their symptoms are likely psychosomatic and do not require further medical workup. Option D. Initiate a broad differential diagnosis, considering both common and less common causes of fatigue, and plan for further targeted investigations based on the patient's reported symptoms and medical history. Correct answer is D. Initiate a broad differential diagnosis, considering both common and less common causes of fatigue, and plan for further targeted investigations based on the patient's reported symptoms and medical history. Explanation. This scenario is professionally challenging because the FNP must integrate subjective patient reports with objective physical findings, recognizing that discrepancies can arise from various factors including patient perception, communication barriers, or subtle underlying pathology. The FNP's responsibility extends beyond simply identifying symptoms to understanding their context and potential implications for the patient's overall health and well-being. Careful judgment is required to avoid premature conclusions and to ensure a comprehensive and accurate diagnostic process. The correct approach represents best professional practice because it prioritizes a systematic, patient-centered, and evidence-based methodology. This involves a thorough history, a comprehensive physical examination, and the judicious use of diagnostic tools, all while maintaining open communication with the patient. This aligns with the ethical principles of beneficence and non-maleficence, ensuring that the patient receives appropriate care and that potential harms are minimized. Regulatory frameworks for FNPs emphasize the importance of accurate assessment and diagnosis as the foundation for safe and effective patient care. An incorrect approach that relies solely on subjective reporting without objective verification fails to meet the standard of care and regulatory expectations for advanced practice. This could lead to misdiagnosis or delayed diagnosis, potentially harming the patient. Ethically, it violates the duty to provide competent care. Another incorrect approach that focuses exclusively on objective findings, while dismissing the patient's subjective experience, overlooks crucial diagnostic clues and can erode patient trust, which is a cornerstone of the therapeutic relationship and a key element in effective care delivery. This approach also fails to meet the comprehensive assessment requirements mandated by professional standards. An approach that prematurely initiates treatment based on incomplete assessment is a direct violation of regulatory guidelines that require a thorough diagnostic process before intervention, risking adverse effects and ineffective treatment. Professionals should employ a decision-making framework that begins with active listening and empathetic engagement with the patient to gather subjective data. This is followed by a systematic and targeted physical examination to gather objective data. The FNP must then critically analyze the congruence and discrepancies between subjective and objective findings, considering differential diagnoses. This analysis should guide the selection of appropriate diagnostic tests and further investigations. Throughout this process, continuous communication with the patient, including clarification of findings and discussion of potential next steps, is essential. This iterative process ensures that the assessment is dynamic, responsive to new information, and ultimately leads to an accurate diagnosis and an individualized treatment plan. Question 4. Market research demonstrates a growing trend of parental hesitancy towards conventional medical treatments for pediatric conditions, often influenced by alternative health philosophies. As a family nurse practitioner, you are caring for a 3-year-old child diagnosed with a severe bacterial pneumonia requiring immediate intravenous antibiotics and respiratory support. The parents, citing concerns about potential side effects and a preference for natural remedies, refuse the recommended antibiotic therapy and respiratory support, insisting on herbal treatments and rest. The child's condition is deteriorating rapidly, with increasing respiratory distress. What is the most appropriate course of action? Option A. Initiate a multidisciplinary consultation including pediatric pulmonology, social work, and hospital legal counsel to assess the situation and determine the best course of action to protect the child's welfare, while continuing to engage the parents in dialogue about the risks and benefits of the recommended treatment. Option B. Inform the parents that their refusal constitutes medical neglect and threaten to involve Child Protective Services if they do not comply with the recommended treatment immediately. Option C. Immediately administer the intravenous antibiotics and initiate respiratory support without further parental consent, as the child's life is in imminent danger. Option D. Document the parent's refusal of treatment and discharge the child home with instructions for supportive care, respecting their autonomy in medical decision-making for their child. The correct answer is A. Initiate a multidisciplinary consultation including pediatric pulmonology, social work, and hospital legal counsel to assess the situation and determine the best course of action to protect the child's welfare, while continuing to engage the parents in dialogue about the risks and benefits of the recommended treatment. Explanation. This scenario presents a professional challenge due to the inherent conflict between parental autonomy and the FNP's ethical and legal obligation to ensure the child's well-being. The parent's refusal of a recommended, evidence-based treatment for a serious pediatric condition, based on personal beliefs rather than medical contraindications, places the child at significant risk of harm. The FNP must navigate this delicate situation with sensitivity, respect for the family's values, and a firm commitment to the child's best interests, all within the bounds of FNP practice regulations and ethical guidelines. The correct approach prioritizes the child's safety and well-being, while respecting parental rights to the extent legally and ethically permissible. This involves a thorough assessment of the parent's understanding of the condition and treatment, exploration of their concerns, and provision of clear, unbiased information about the risks and benefits of the recommended treatment and the consequences of inaction. If, after extensive counseling and attempts to reach a consensus, the parents continue to refuse life-saving or limb-saving treatment, the FNP has a professional and legal duty to consult with the healthcare team, including legal counsel and Child Protective Services, to determine the appropriate course of action to protect the child. This aligns with the FNP's scope of practice, which mandates advocating for the patient, adhering to evidence-based practice, and reporting suspected child abuse or neglect, which can include medical neglect. An incorrect approach would be to immediately override parental decisions without attempting to understand or address their concerns. This disrespects parental autonomy and can erode trust, making future collaboration difficult. It may also violate regulations regarding informed consent and the process for escalating concerns about medical neglect. Another incorrect approach would be to simply document the parent's refusal and do nothing further, effectively abandoning the child to potential harm. This fails to meet the FNP's ethical obligation to advocate for the patient and could be considered a breach of professional duty, potentially leading to regulatory sanctions. Finally, pressuring or coercing the parents into accepting treatment without addressing their underlying fears or beliefs is ethically unsound and can lead to resentment and non-adherence, ultimately not serving the child's best interest. Professional decision-making in such situations requires a systematic approach. First, gather all necessary clinical information and assess the child's condition and prognosis. Second, engage in open and empathetic communication with the parents, actively listening to their concerns and understanding their perspective. Third, provide comprehensive, evidence-based information about the condition, treatment options, and potential outcomes. Fourth, explore alternatives or modifications to the treatment plan that might address parental concerns without compromising the child's health. Fifth, if consensus cannot be reached and the child's health is at significant risk, consult with the interdisciplinary team, including supervisors, specialists, and legal counsel, to determine the next steps, which may include involving Child Protective Services. Question 5. Process analysis reveals a 68-year-old female patient presenting with new-onset shortness of breath, bilateral leg swelling, and intermittent abdominal discomfort. She denies chest pain or fever. The FNP is tasked with initiating a systems-based assessment. Which of the following approaches best reflects a comprehensive and prioritized evaluation strategy? Option A. Immediately assume the symptoms are related to anxiety and recommend relaxation techniques, deferring a detailed physical examination of the cardiovascular, respiratory, and gastrointestinal systems. Option B. Begin with a detailed gastrointestinal assessment, inquiring about diet, bowel habits, and any history of abdominal pain, before addressing the respiratory and cardiovascular symptoms. Option C. Focus initially on a thorough cardiovascular and respiratory examination, including auscultation of lung sounds and heart sounds, assessment of peripheral pulses and edema, and then proceed to a gastrointestinal assessment. Option D. Prioritize a musculoskeletal assessment to rule out any underlying orthopedic issues that might be contributing to the leg swelling, before evaluating the more acute respiratory and abdominal complaints. Correct answer is B. Begin with a detailed gastrointestinal assessment, inquiring about diet, bowel habits, and any history of abdominal pain, before addressing the respiratory and cardiovascular symptoms. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the FNP to synthesize information from multiple body systems to identify a potentially serious underlying condition. The patient presents with seemingly disparate symptoms, dyspnea, leg swelling, abdominal discomfort, necessitating a comprehensive, systems-based assessment to avoid misdiagnosis or delayed treatment. The FNP must prioritize which systems to investigate further based on the initial presentation and patient history, demonstrating critical thinking and clinical judgment. Correct approach analysis. The correct approach involves a systematic, head-to-toe assessment that prioritizes the most concerning symptoms and then expands to related systems. This aligns with best professional practice as outlined by the American Association of Nurse Practitioners (ANP) and the Nurse Practice Act of specified U.S. state, e.g., California. A thorough cardiovascular and respiratory assessment is paramount given the dyspnea and leg swelling, as these could indicate heart failure or pulmonary embolism. Following this, a gastrointestinal assessment is crucial due to the abdominal discomfort, and then a review of other systems to rule out contributing factors or comorbidities. This methodical approach ensures all potential causes are considered and addressed according to established clinical guidelines and scope of practice. Incorrect approach is analysis, an approach that focuses solely on the gastrointestinal symptoms, without adequately investigating the cardiovascular and respiratory complaints would be a regulatory and ethical failure. This neglects the FNP's responsibility to conduct a comprehensive assessment and could lead to a misdiagnosis of a life-threatening cardiovascular or pulmonary condition, violating the standard of care, and potentially the Nurse Practice Act's provisions regarding patient safety and competent practice. Another incorrect approach would be to dismiss the leg swelling as unrelated to the dyspnea without a thorough cardiovascular and vascular assessment. This demonstrates a lack of critical thinking and a failure to connect potentially related symptoms, which is contrary to the principles of holistic patient care, and could result in delayed diagnosis and treatment of conditions like deep vein thrombosis or worsening heart failure, thereby failing to meet the expected standard of care. An approach that prematurely concludes the symptoms are psychosomatic without ruling out organic causes through a systematic physical examination and relevant diagnostic workup would also be professionally unacceptable. This could be considered a violation of the ethical principle of non-maleficence if it leads to inadequate treatment or a failure to diagnose a treatable condition. Professional reasoning. The FNP should utilize a systematic decision-making framework that begins with a thorough history and review of presenting complaints. This is followed by a prioritized physical examination, focusing on the most critical body systems indicated by the symptoms. Based on the physical findings, the FNP then formulates a differential diagnosis, orders appropriate diagnostic tests, and develops a treatment plan. This iterative process, guided by evidence-based practice and regulatory requirements, ensures comprehensive and safe patient care. Question 6. Investigation of a 65-year-old male patient with a 10-year history of hypertension, currently prescribed lisinopril 20 mg daily, reveals he reports feeling tired and a bit dizzy for the past month. He denies chest pain, shortness of breath, or other acute symptoms. His home blood pressure readings have been consistently around 130/80 mmHg. The FNP is considering how to best address the patient's concerns while ensuring continued effective management of his hypertension. Which of the following approaches best reflects current FNP prescribing practices for common conditions in this scenario? Option A. Conduct a thorough physical examination. Review the patient's medication adherence and potential drug interactions. Explore the patient's understanding of their condition and treatment. And consult evidence-based guidelines for hypertension management to determine if a dose adjustment, alternative medication, or further investigation is warranted. Option B. Prescribe a stimulant medication to counteract the reported fatigue and dizziness, without further investigation into the cause of these symptoms. Option C. Advise the patient to continue taking lisinopril as prescribed, reassuring him that his blood pressure readings are within acceptable limits and that his symptoms are likely unrelated to the medication. Option D. Immediately discontinue lisinopril and initiate a new antihypertensive medication from a different drug class, as the patient's subjective complaints indicate a clear adverse reaction. The correct answer is A. Conduct a thorough physical examination. Review the patient's medication adherence and potential drug interactions. Explore the patient's understanding of their condition and treatment, and consult evidence-based guidelines for hypertension management to determine if a dose adjustment, alternative medication, or further investigation is warranted. Explanation. Scenario analysis. This scenario presents a common clinical challenge for an FNP, managing a patient with a chronic condition requiring ongoing medication management, where adherence and efficacy are paramount. The challenge lies in balancing the patient's expressed concerns about side effects with the established therapeutic benefits of the current medication, while adhering to prescribing regulations and best practices for chronic disease management. The FNP must critically evaluate the patient's subjective experience against objective clinical data and established guidelines, ensuring patient safety and optimal health outcomes. Correct approach analysis. The correct approach involves a comprehensive assessment of the patient's current condition, including a thorough review of their medical history, current medications, and any reported side effects. This includes exploring the patient's understanding of their condition and treatment, assessing adherence, and performing a physical examination to identify any objective signs related to their concerns. Based on this assessment, the FNP should then consult current evidence-based guidelines for managing hypertension and consider alternative therapeutic options if indicated, always prioritizing patient safety and informed consent. This aligns with the FNP's scope of practice, which mandates evidence-based care, patient-centered decision-making, and adherence to state-specific prescribing regulations that require a thorough evaluation before altering or discontinuing prescribed medications. The decision to adjust or change medication should be a collaborative one, made after a complete understanding of the patient's situation and in accordance with established clinical protocols. Incorrect approaches analysis. One incorrect approach would be to immediately discontinue the current medication based solely on the patient's subjective report of feeling unwell, without further investigation. This fails to adhere to the principle of evidence-based practice and may lead to suboptimal management of the patient's hypertension, potentially increasing their risk of cardiovascular events. It also bypasses the regulatory requirement to thoroughly assess a patient before making significant changes to their treatment plan. Another incorrect approach would be to prescribe a new medication without adequately assessing the patient's current status or exploring the root cause of their reported side effects. This could lead to polypharmacy, increased risk of drug interactions, and failure to address the underlying issue, violating ethical obligations to provide safe and effective care. It also disregards the need for a systematic approach to medication management as outlined in professional practice standards. A third incorrect approach would be to dismiss the patient's concerns and insist on continuing the current medication without exploring potential alternatives or adjustments. This undermines the patient-provider relationship, erodes trust, and fails to acknowledge the patient's lived experience, which is a critical component of patient-centered care. It also neglects the FNP's responsibility to explore all reasonable therapeutic options to optimize patient well-being. Professional reasoning. The professional decision-making process for this scenario should follow a structured approach. 1. Patient assessment. Gather comprehensive subjective and objective data related to the patient's condition and reported concerns. 2. Differential diagnosis/problem identification. Identify potential causes for the patient's reported symptoms, including medication side effects, disease progression, or other contributing factors. 3. Evidence-based practice review. Consult current clinical guidelines and research for the management of hypertension and potential side effects of prescribed medications. 4. Treatment planning. Develop a collaborative treatment plan with the patient, considering therapeutic goals, risks, benefits, and patient preferences. This may involve dose adjustments, medication changes, or non-pharmacological interventions. 5. Monitoring and evaluation. Establish a plan for ongoing monitoring of the patient's response to treatment and any adverse effects. 6. Documentation. Thoroughly document all assessments, decisions, and treatment plans in the patient's medical record. Question 7. What factors determine the appropriate selection and dosing of pharmacologic agents for pediatric patients, considering their unique physiological and developmental characteristics? Option A. The adult dosage of the medication, adjusted by a standard percentage based on the child's age. Option B. The prescriber's personal experience with the medication in adult patients. Option C. The availability of the medication in a liquid formulation, regardless of precise dosing calculations. Option D. The child's current weight, age, specific medical condition, renal and hepatic function, and potential drug interactions, in conjunction with current pediatric pharmacology guidelines. The correct answer is D. The child's current weight, age, specific medical condition, renal and hepatic function, and potential drug interactions, in conjunction with current pediatric pharmacology guidelines. Explanation. This scenario is professionally challenging because the FNP must navigate the complexities of pediatric pharmacology, which differ significantly from adult pharmacokinetics and pharmacodynamics. Factors such as immature organ systems, liver, kidneys, altered protein binding, and different body composition in children necessitate careful dosage adjustments and drug selection to ensure efficacy and minimize toxicity. The FNP's responsibility extends beyond simply prescribing a medication. It involves a comprehensive assessment of the child's developmental stage, weight, specific condition, potential drug interactions, and parental understanding and adherence. The correct approach represents best professional practice because it prioritizes patient safety and evidence-based care, aligning with the FNP's scope of practice and ethical obligations. This involves a thorough assessment of the child's individual characteristics, consultation of current pediatric drug references and guidelines, and consideration of the child's developmental stage and physiological status. This approach ensures that medication selection and dosing are tailored to the unique needs of the pediatric patient, minimizing risks and maximizing therapeutic outcomes, in accordance with the principles of patient-centered care and professional accountability. An incorrect approach that relies solely on adult dosing guidelines fails to acknowledge the physiological differences in children, leading to potential under- or overdosing, which can result in treatment failure or adverse drug events. This is a regulatory and ethical failure, as it deviates from the standard of care for pediatric patients and violates the principle of beneficence. Another incorrect approach that ignores the child's weight and instead uses age-based dosing can be imprecise and lead to significant dosing errors, as children of the same age can have vastly different weights and metabolic rates. This is a failure to apply evidence-based practice and can result in harm, violating the duty of care. A third incorrect approach that does not consider potential drug interactions or contraindications specific to pediatric populations risks exacerbating existing conditions or causing new adverse effects, representing a failure to conduct a thorough medication reconciliation and risk assessment, which is a core component of safe prescribing. The professional decision-making process for similar situations should involve a systematic approach. 1. Comprehensive patient assessment, including age, weight, medical history, current medications, and developmental stage. 2. Identification of the most appropriate medication based on current evidence-based guidelines for pediatric use. 3. Calculation of the correct dose using pediatric-specific dosing information, often based on weight, mg/kg. 4. Consideration of the route of administration and formulation suitable for the child. 5. Assessment of potential drug interactions and contraindications. 6. Patient and family education regarding the medication, administration, expected effects, and potential side effects. 7. Ongoing monitoring for efficacy and adverse events. Question 8. When evaluating the implementation of new evidence-based clinical guidelines for managing hypertension in a primary care setting, which approach best reflects current family nurse practitioner, FNP, professional practice standards? Option A. Implementing the new guidelines recommendations without critical appraisal, assuming all recommendations are universally applicable and beneficial. Option B. Focusing solely on guideline recommendations that are easily integrated into existing workflows, without considering patient preferences or the underlying evidence. Option C. Prioritizing a thorough review of the guidelines' evidence base, assessing its applicability to the diverse patient population served, and engaging patients in shared decision-making regarding treatment options. Option D. Strictly adhering to the most recently updated institutional protocols, even if they do not fully reflect the latest guideline recommendations. The correct answer is C. Prioritizing a thorough review of the guidelines' evidence base, assessing its applicability to the diverse patient population served, and engaging patients in shared decision-making regarding treatment options. Explanation. This scenario presents a common challenge for family nurse practitioners, FNP, in adhering to evolving evidence-based clinical guidelines while managing patient care. The professional challenge lies in balancing the imperative to provide the most current and effective care with the practical realities of patient adherence, resource availability, and individual patient circumstances. Careful judgment is required to integrate guideline recommendations into personalized care plans. The correct approach represents best professional practice because it prioritizes a systematic and patient-centered method for guideline implementation. This involves critically appraising the evidence supporting the guideline, considering its applicability to the specific patient population and individual patient factors, and engaging the patient in shared decision-making. This aligns with the ethical principles of beneficence, non-maleficence, and patient autonomy, as well as professional standards that mandate the use of evidence-based practice. Regulatory frameworks for advanced practice nursing often emphasize the importance of staying current with best practices and providing care that meets established standards of quality. An incorrect approach that relies solely on outdated institutional protocols fails to meet the standard of care dictated by current evidence. This represents a regulatory failure to adhere to evolving professional knowledge and an ethical lapse in providing suboptimal care. Another incorrect approach that disregards patient preferences and socioeconomic factors in favor of strict guideline adherence can lead to non-adherence, patient dissatisfaction, and potentially poorer health outcomes, violating principles of patient-centered care, and potentially leading to ethical and regulatory scrutiny for failing to provide individualized care. A third incorrect approach that blindly adopts a new guideline without critical appraisal or consideration of its evidence base risks implementing recommendations that may not be robust, appropriate, or cost-effective, potentially leading to patient harm, and a failure to meet professional obligations for evidence-informed practice. A professional decision-making process for similar situations should involve a continuous learning cycle, staying abreast of new research and guideline updates, critically evaluating the strength and applicability of new evidence, discussing guideline recommendations with patients, and tailoring treatment plans to individual needs and preferences within the scope of practice and available resources. This iterative process ensures that care remains evidence-based, ethical, and patient-centered. Question 9. Cost-benefit analysis shows that early identification of developmental delays significantly reduces long-term healthcare costs and improves child outcomes. Yet a family nurse practitioner, FNP, is faced with assessing 3 children in one family: a 6-month-old infant, a 4-year-old preschooler, and a 10-year-old school-aged child. Which approach to developmental assessment across the lifespan is most appropriate and ethically sound for this FNP? Option A. Administering a single, comprehensive developmental questionnaire designed for school-aged children to all 3 siblings to ensure consistency in data collection. Option B. Utilizing age-specific screening tools and observational techniques tailored to the unique developmental stage of each child, integrating parental input throughout the process. Option C. Prioritizing the assessment of the 10-year-old, as older children typically have more complex developmental needs and their assessment will provide a broader picture of the family's overall developmental health. Option D. Relying solely on parental reports for all developmental assessments, as parents are the primary caregivers and have the most insight into their children's behavior. The correct answer is A. Administering a single, comprehensive developmental questionnaire designed for school-age children to all 3 siblings to ensure consistency in data collection. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the FNP to integrate developmental assessment across a broad age spectrum, from infancy to adolescence, within a single family context. The challenge lies in recognizing that developmental milestones and appropriate assessment tools vary significantly by age, and a one-size-fits-all approach is ineffective and potentially harmful. The FNP must also consider the family dynamics and how they might influence or be influenced by the developmental status of each child. Accurate and timely developmental assessment is crucial for early identification of potential delays or disorders, enabling prompt intervention and support, which directly impacts long-term health outcomes and family well-being. Correct approach analysis. The correct approach involves utilizing age-appropriate screening tools and observational techniques tailored to each child's specific developmental stage. For infants, this might include assessing gross and fine motor skills, social interaction, and communication through tools like the Ages and Stages questionnaires ask, or direct observation of feeding and play. For toddlers, the focus shifts to language development, problem solving, and social play, potentially using the Denver Developmental Screening Test, DDST-2, or similar instruments. For school-age children and adolescents, the assessment expands to include cognitive abilities, academic performance, social-emotional functioning, and risk-taking behaviors, often involving standardized questionnaires for parents and children, as well as clinical interviews. This individualized, age-specific approach aligns with best practices in pediatric and family health care, emphasizing the importance of recognizing and addressing developmental variations at each life stage. It also adheres to ethical principles of beneficence and non-maleficence by ensuring that interventions are based on accurate assessments and are tailored to the individual needs of each child. Incorrect approach is analysis, an approach that relies solely on parental report without incorporating objective developmental screening tools or direct observation for all children would be ethically problematic. Parental input is valuable. It can be subjective and may not always capture subtle developmental nuances or delays. This failure to employ validated screening instruments could lead to misdiagnoses, violating the principle of beneficence. Another incorrect approach would be to use a single, generic developmental questionnaire for all children in the family, regardless of their age. This would be a significant regulatory and ethical failure, as it fails to acknowledge the distinct developmental trajectories of infants, toddlers, school-age children, and adolescents. Such an approach would likely result in inaccurate assessments, potentially leading to inappropriate interventions or a lack of necessary support, thereby violating the principle of non-maleficence and failing to meet professional standards of care. Finally, an approach that prioritizes the assessment of only the most outwardly symptomatic child, while neglecting the developmental screening of other siblings, would be professionally unacceptable. This selective assessment ignores the interconnectedness of family health and the potential for developmental issues to manifest differently across siblings. It represents a failure to provide comprehensive care to all members of the family unit, which is a core tenet of family nursing practice and could lead to delayed identification of issues in other children. Professional reasoning. FNPs should employ a systematic, age-stratified approach to developmental assessment. This involves maintaining a current knowledge base of age-specific developmental milestones and validated screening tools. When faced with a family with multiple children across different age groups, the FNP should plan for individualized assessments for each child. This includes selecting appropriate screening tools, incorporating direct observation, and engaging in age-appropriate communication with both the children and their parents. The decision-making process should prioritize early identification and intervention, ensuring that all children receive the necessary support to reach their full developmental potential. This aligns with the FNP's role in promoting health and preventing disease across the lifespan. Question 10. The performance metrics show a slight increase in the average time spent per patient encounter, prompting a review of the family nurse practitioner's head-to-toe assessment process. Which of the following strategies best balances thoroughness with efficiency while adhering to professional standards for comprehensive patient evaluation? Option A. Reducing the duration of assessment for non-acute complaints by focusing only on the presenting problem and related systems. Option B. Implementing a standardized checklist for each body system within the head-to-toe assessment to ensure all key components are addressed systematically during every encounter. Option C. Delegating the initial assessment of certain body systems to unlicensed assistive personnel before the FNP begins their comprehensive evaluation. Option D. Relying primarily on patient self-reported symptoms to gather information about each body system, minimizing direct physical examination. The correct answer is B. Implementing a standardized checklist for each body system within the head-to-toe assessment to ensure all key components are addressed systematically during every encounter. Explanation: this scenario presents a professional challenge due to the inherent variability in patient presentation and the need to balance thoroughness with efficiency in a clinical setting. The FNP must exercise sound clinical judgment to ensure all critical aspects of a head-to-toe assessment are covered without compromising patient care or exceeding allocated time. Regulatory frameworks for family nurse practitioners emphasize the importance of comprehensive patient assessment as a cornerstone of safe and effective care. Adherence to these standards is not merely a matter of good practice, but a legal and ethical obligation. The correct approach represents best professional practice because it prioritizes a systematic and comprehensive head-to-toe assessment that aligns with established FNP scope of practice and regulatory guidelines. This approach ensures that all body systems are evaluated, potential deviations from normal are identified, and appropriate interventions can be initiated promptly. Such a methodical process minimizes the risk of misdiagnosis or delayed treatment, thereby upholding the FNP's duty of care and adhering to professional standards that mandate thorough patient evaluation. An incorrect approach that neglects a specific body system during the assessment is professionally unacceptable due to regulatory and ethical failures. Specifically, it violates the FNP's obligation to provide comprehensive care as outlined by professional nursing standards and potentially state-specific nurse practice acts. Ethically, this constitutes a breach of the duty to do no harm and to act in the patient's best interest. Failing to assess a system, such as the neurological or cardiovascular system, could lead to the omission of critical findings, resulting in adverse patient outcomes and potential malpractice claims. Another incorrect approach that relies solely on patient self-reporting without objective physical examination is also problematic. This fails to meet the standard of care for a physical assessment, which requires objective data collection through direct observation, palpation, percussion, and auscultation. Regulatory bodies expect FNPs to perform hands-on assessments, not to delegate this critical function to the patient's subjective experience alone. The professional decision-making process for similar situations should involve a structured approach. First, the FNP should review the patient's chief complaint and history of present illness to identify potential areas of focus for the head-to-toe assessment. Second, the FNP should recall and apply the systematic head-to-toe assessment framework, ensuring each system is addressed. Third, the FNP should integrate critical thinking skills to identify any red flags or urgent findings that require immediate attention, potentially altering the sequence of the assessment. Finally, the FNP must document the assessment findings accurately and comprehensively, reflecting the thoroughness of the evaluation and any subsequent interventions. Question 11. Stakeholder feedback indicates that some family nurse practitioners are struggling to effectively reconcile patient-reported symptoms with objective physical examination findings, leading to potential diagnostic delays. A 65-year-old male presents with a chief complaint of intermittent chest pain, which he describes as a tightness that occurs primarily after exertion and resolves with rest. His medical history includes hypertension and hyperlipidemia, for which he takes medication. During the physical examination, his vital signs are stable, and his cardiopulmonary exam is unremarkable, with clear lung sounds and regular heart rhythm without murmurs. However, he reports experiencing significant anxiety when discussing his symptoms, and his hands appear slightly clammy. Which of the following approaches best integrates the patient history and physical findings to guide further assessment and management? Option A. Acknowledge the patient's subjective report of chest tightness and the presence of anxiety symptoms, but prioritize the objective finding of an unremarkable cardiopulmonary exam, concluding that further cardiac workup is not immediately necessary. Option B. Critically evaluate the discrepancy between the patient's reported exertional chest pain, a classic symptom of angina, and the currently unremarkable physical exam. This necessitates further investigation, such as an electrocardiogram, ECG, and potentially a stress test, to rule out underlying cardiac ischemia, while also considering the role of anxiety. Option C. Dismiss the patient's chest pain complaint as psychosomatic due to his reported anxiety and clammy hands, and focus treatment on managing his anxiety symptoms. Option D. Focus solely on the unremarkable cardiopulmonary exam findings, reassuring the patient that his symptoms are likely benign and related to anxiety, and advise him to manage his stress. The correct answer is D. Focus solely on the unremarkable cardiopulmonary exam findings, reassuring the patient that his symptoms are likely benign and related to anxiety, and advise him to manage his stress. Explanation. This scenario presents a common challenge in family nurse practitioner, FNP, practice, synthesizing disparate patient information to form a coherent clinical picture. The difficulty lies in the potential for conflicting data between a patient's self-reported history and objective physical findings, requiring the FNP to critically evaluate the reliability and significance of each piece of information. Professional judgment is paramount to avoid diagnostic errors and ensure patient safety. The correct approach involves a systematic and critical integration of all available data. This means not accepting patient history at face value without considering physical findings, and vice versa. The FNP must actively seek to reconcile discrepancies, perhaps by re-examining the patient, asking clarifying questions, or considering differential diagnoses that could explain the observed findings in light of the reported history. This aligns with the FNP's ethical and professional responsibility to provide comprehensive and evidence-based care, as mandated by state nurse practice acts and professional nursing standards, which emphasize thorough assessment and accurate diagnosis. The American Nurses Association, ANA, Code of Ethics also guides this, stressing the importance of accurate assessment and informed decision-making. An incorrect approach would be to prioritize one source of information over the other without critical evaluation. For instance, solely relying on the patient's history and dismissing objective physical findings that contradict it would be a failure to conduct a complete and accurate assessment, potentially violating the Nurse Practice Act's requirements for competent practice. Conversely, disregarding the patient's subjective experience and focusing only on physical findings could lead to a depersonalized approach and missed diagnostic clues, undermining the therapeutic relationship and potentially violating ethical principles of patient-centered care. Another incorrect approach would be to make a diagnosis based on incomplete data, failing to investigate discrepancies, which is a direct contravention of the standards of care expected of an FNP. The professional decision-making process for similar situations should involve a structured approach. First, gather all available data, history, physical exam, diagnostics. Second, identify any discrepancies or conflicts between these data points. Third, critically analyze the potential causes of these discrepancies, considering patient factors, e.g., memory, understanding, intent. Examiner factors, e.g., technique, interpretation, and the nature of the condition itself. Fourth, formulate a differential diagnosis that accounts for all findings. Fifth, develop a plan to resolve the discrepancies, which may involve further questioning, re-examination, or additional diagnostic tests. Finally, integrate all resolved data to arrive at a definitive diagnosis and treatment plan. Question 12. Market research demonstrates a growing demand for effective chronic pain management, leading family nurse practitioners, FNP, to frequently prescribe Schedule Roman IV controlled substances. An FNP is managing a patient with chronic back pain who has been on a stable dose of a Schedule Roman IV opioid analgesic for 6 months. The patient reports increased pain and requests a higher dose. The FNP needs to determine the most appropriate course of action to ensure patient safety and regulatory compliance. Which of the following approaches best reflects current FNP practice standards and regulatory requirements for managing controlled substances in this scenario? Option A. Immediately discontinue the Schedule Roman IV medication and refer the patient to a pain specialist without further discussion or a tapering plan. Option B. Initiate a comprehensive reassessment of the patient's pain, including a review of the controlled substance agreement, a urine drug screen, and a check of the Prescription Drug Monitoring Program (PDMP) database before considering any changes to the medication regimen. Option C. Prescribe a higher dose of the Schedule Roman IV medication based on the patient's self-report of increased pain, without conducting a urine drug screen or checking the PDMP. Option D. Increase the patient's current medication dose by 25% as requested, assuming the patient's report of increased pain is accurate and the previous dose was effective. Correct answer is B. Initiate a comprehensive reassessment of the patient's pain, including a review of the Controlled Substance Agreement, a urine drug screen, and a check of the Prescription Drug Monitoring Program (PDMP) database before considering any changes to the medication regimen. Explanation: this scenario presents a common challenge for family nurse practitioners, FNP, involving the management of controlled substances, specifically Schedule Roman IV medications, for patients with chronic pain. The professional challenge lies in balancing the legitimate therapeutic needs of the patient with the stringent legal and ethical obligations surrounding controlled substance prescribing. FNPs must navigate complex regulations, patient safety concerns, and the potential for diversion or misuse, all while maintaining a therapeutic relationship. Careful judgment is required to assess patient risk factors, monitor treatment effectiveness, and adhere to state and federal guidelines. The correct approach represents best professional practice because it prioritizes patient safety and regulatory compliance through a comprehensive, evidence-based strategy. This involves a thorough initial assessment, including a controlled substance agreement, urine drug screening, and prescription drug monitoring program, PDMP, checks, which are all mandated or strongly recommended by regulatory bodies for Schedule Roman IV substances. Ongoing monitoring, regular follow-up appointments, and reassessment of the treatment plan are crucial for ensuring efficacy, detecting adverse effects, and preventing misuse or diversion. This aligns with the principles of responsible prescribing and the FNP's duty of care, as outlined by state boards of nursing and federal controlled substance regulations. An incorrect approach that involves prescribing a higher dose without adequate justification or further assessment fails to meet the FNP's professional and legal obligations. This could be considered negligent prescribing, as it bypasses essential risk mitigation strategies and may violate state-specific prescribing guidelines for controlled substances. Prescribing without a clear treatment plan or documented rationale for dose escalation increases the risk of adverse events and diversion, potentially leading to disciplinary action from the licensing board. Another incorrect approach, such as abruptly discontinuing the medication without a tapering plan or patient consultation, is ethically problematic and potentially harmful. While patient safety is paramount, sudden cessation of chronic pain medication can lead to withdrawal symptoms, increased pain, and psychological distress, negatively impacting the patient's well-being and trust in the provider. This approach neglects the established protocols for managing controlled substance dependence and withdrawal, which are often implicitly or explicitly covered by professional practice standards and ethical guidelines. Finally, an approach that relies solely on patient self-report without objective verification through urine drug screens or PDMP checks is insufficient. This overlooks the potential for inaccurate reporting, diversion, or co-ingestion of other substances, all of which are critical considerations when managing controlled substances. Regulatory frameworks emphasize the importance of objective data to ensure safe and effective prescribing practices. The professional decision-making process for similar situations should involve a systematic approach. 1. Thorough patient assessment, including history, physical examination, and psychosocial factors. 2. Review of PDMP data and previous prescription history. 3. Development of a clear individualized treatment plan with specific goals and monitoring parameters. 4. Implementation of risk mitigation strategies, such as a controlled substance agreement and urine drug screening. 5. Regular and frequent follow-up to assess efficacy, safety, and adherence. 6. Open communication with the patient regarding treatment expectations, risks, and benefits. 7. Adherence to all applicable state and federal regulations regarding controlled substance prescribing. Question 13. Cost-benefit analysis shows that a thorough, patient-centered approach to comprehensive health history taking yields better diagnostic accuracy and patient adherence, but requires more time. As a family nurse practitioner in the United States, Which of the following approaches best aligns with regulatory and ethical best practices when initiating a new patient encounter? Option A. Focus exclusively on the patient's chief complaint, gathering only the information directly related to the immediate symptoms. Option B. Begin by clearly explaining the purpose of the health history, assuring confidentiality, and then proceeding with open-ended questions to build rapport before delving into specific health concerns. Option C. Immediately commence with a rapid-fire, comprehensive checklist of all possible health conditions and lifestyle factors to ensure no detail is missed. Option D. Make assumptions about the patient's health risks based on their age and gender, and tailor questions accordingly without extensive preamble. The correct answer is B. Begin by clearly explaining the purpose of the health history, assuring confidentiality, and then proceeding with open-ended questions to build rapport before delving into specific health concerns. Explanation. Scenario analysis. This scenario is professionally challenging because the FNP must balance the immediate need for comprehensive health information with the patient's potential discomfort or reluctance to disclose sensitive details. The FNP's approach directly impacts the quality of care, patient trust, and adherence to ethical and regulatory standards for patient privacy and informed consent. The challenge lies in eliciting necessary information without compromising the therapeutic relationship or violating patient rights. Correct approach analysis. The correct approach prioritizes establishing rapport and trust by explaining the purpose of the health history and assuring confidentiality. This aligns with the ethical principle of beneficence, acting in the patient's best interest, and non-maleficence, avoiding harm, including psychological distress from intrusive questioning. Legally, this approach supports informed consent, as the patient understands why information is being gathered and how it will be used, which is a cornerstone of patient-centered care under U.S. healthcare regulations. It also respects patient autonomy by allowing them to control the pace and depth of disclosure. Incorrect approach is analysis, an approach that immediately launches into a detailed, exhaustive list of questions without preamble or explanation, fails to establish trust, and can alienate the patient, hindering the collection of accurate information. This can be seen as a violation of the ethical principle of respect for persons, and potentially a breach of the implicit contract of care, leading to a less effective therapeutic alliance. It also risks overwhelming the patient, which could be construed as causing unnecessary distress. Another incorrect approach involves making assumptions about the patient's health status or lifestyle based on superficial observations or demographic information. This is ethically problematic as it can lead to biased care and diagnostic errors, violating the principle of justice and potentially leading to harm. It also undermines the patient's autonomy by not allowing them to present their own narrative and health concerns. A third incorrect approach is to focus solely on the presenting problem without exploring broader health and social determinants. While efficient for immediate symptom management, it neglects the FNP's responsibility to provide holistic care, which is a core tenet of advanced practice nursing. This can lead to misdiagnoses of coexisting conditions or underlying issues that impact the patient's overall well-being, thus failing to fully meet the standard of care. Professional reasoning. FNPs should employ a patient-centered approach to health history taking. This involves initiating the encounter by building rapport, clearly explaining the purpose of the history, and assuring confidentiality. The FNP should then proceed with open-ended questions, allowing the patient to guide the narrative, and gradually introduce more specific inquiries as trust is established and the clinical context demands. Active listening, empathy, and cultural sensitivity are paramount throughout the process. The FNP must be prepared to adapt their questioning based on the patient's responses and comfort level, always prioritizing the patient's dignity and rights. Question 14. Operational review demonstrates a 68-year-old male patient with a history of hypertension, type 2 diabetes, and a recent diagnosis of benign prostatic hyperplasia, BPH, presence with complaints of dysuria, increased urinary frequency, and mild flank discomfort. The patient is currently taking lisinopril and metformin. Which of the following approaches best represents a risk assessment for potential renal and urinary pathophysiology in this patient? Option A. Recommend immediate discontinuation of lisinopril and metformin to reduce potential strain on the kidneys, pending further investigation. Option B. Prioritize a comprehensive assessment of the patient's current renal function, including urinalysis and serum creatinine levels, alongside a review of his medication list for nephrotoxic agents or drugs requiring renal dose adjustment, while also evaluating for signs of urinary tract infection or obstruction related to BPH. Option C. Rely solely on the patient's subjective report of flank discomfort to guide further diagnostic workup, without performing objective laboratory or imaging studies. Option D. Focus primarily on initiating a course of broad-spectrum antibiotics to address the dysuria and frequency, assuming a urinary tract infection is the most likely cause of his symptoms. The correct answer is B. Prioritize a comprehensive assessment of the patient's current renal function, including urinalysis and serum creatinine levels, alongside a review of his medication list for nephrotoxic agents or drugs requiring renal dose adjustment, while also evaluating for signs of urinary tract infection or obstruction related to BPH. Explanation: Scenario analysis. This scenario is professionally challenging because it requires the FNP to integrate knowledge of renal and urinary pathophysiology with a risk assessment framework to identify potential complications in a patient with a complex medical history. The challenge lies in discerning the most critical risk factors and prioritizing interventions based on their potential impact on renal function and overall patient safety, all within the scope of FNP practice as defined by Specify U.S. State Nurse Practice Act, e.g., the California Nurse Practice Act. Correct approach analysis. The correct approach involves a comprehensive assessment of the patient's current renal status, medication regimen, and comorbidities, specifically evaluating for indicators of acute kidney injury, AKI, or chronic kidney disease, CKD, progression. This aligns with the FNP's responsibility to conduct thorough patient assessments, identify risk factors, and implement evidence-based interventions as outlined by the Specify FNP Scope of Practice Guidelines, e.g., American Association of Nurse Practitioners, ANP, Scope of Practice. It also adheres to the ethical principle of beneficence by proactively addressing potential health threats. Incorrect approaches analysis. An approach that solely focuses on managing the patient's hypertension without a concurrent assessment of renal function would be ethically and regulatorily deficient. This fails to meet the standard of care for a patient with known renal compromise and could lead to delayed diagnosis of worsening renal disease, violating the FNP's duty to provide comprehensive care, and potentially breaching the Specify U.S. State Nurse Practice Act requirements for assessment and management of chronic conditions. An approach that prioritizes immediate symptom relief of dysuria without investigating the underlying cause, such as infection or obstruction, would also be problematic. While symptom management is important, neglecting the root cause, especially in a patient with potential renal involvement, could mask a more serious underlying issue, leading to adverse outcomes and failing to meet the FNP's obligation to diagnose and treat conditions appropriately under the Specify U.S. State Nurse Practice Act. An approach that relies solely on patient self-reporting of symptoms without objective data collection, e.g., urinalysis, serum creatinine, would be insufficient. The FNP's role necessitates objective data to inform clinical decision-making, and over-reliance on subjective reports can lead to misdiagnosis or delayed diagnosis, contravening the professional standards of practice and the Specify U.S. State Nurse Practice Act mandate for accurate patient assessment. Professional reasoning. The professional decision-making process in this situation involves a systematic approach. 1. Gather comprehensive subjective and objective data, including a detailed history of renal issues, current medications, and comorbidities. 2. Utilize established risk assessment tools and clinical guidelines for renal disease. 3. Differentiate between potential causes of renal compromise and prioritize interventions based on the severity of risk and potential for harm. 4. Collaborate with the patient and other healthcare providers as necessary. 5. Document all findings, interventions, and patient education thoroughly, adhering to the Specify U.S. State Nurse Practice Act and ethical guidelines. Question 15. The control framework reveals a family nurse practitioner, FNP, is managing a 78-year-old patient with early-stage Alzheimer's disease who has expressed a desire to continue driving, despite recent minor traffic incidents. The patient's daughter is strongly advocating for the FNP to intervene and prevent her mother from driving, citing safety concerns for both the patient and the public. The FNP has observed some subtle cognitive changes, but has not formally assessed the patient's driving capacity. Which of the following actions best aligns with the FNP's professional and regulatory responsibilities in this situation? Option A. Initiate a formal driving capacity assessment for the patient, involving relevant specialists if necessary, and engage in a discussion with the patient and her daughter about the findings and potential next steps, respecting the patient's autonomy while prioritizing safety. Option B. Document the daughter's concerns in the patient's chart and advise the patient to drive more cautiously, without pursuing a formal assessment or involving external agencies, to avoid upsetting the patient and her family. Option C. Immediately inform the Department of Motor Vehicles (DMV) of the patient's cognitive decline and recent incidents, recommending the suspension of her driver's license without further assessment to prevent immediate harm. Option D. Advise the daughter that she has the legal authority to confiscate her mother's car keys and prevent her from driving, as she is the primary caregiver and concerned about safety. The correct answer is A. Initiate a formal driving capacity assessment for the patient, involving relevant specialists if necessary, and engage in a discussion with the patient and her daughter about the findings and potential next steps, respecting the patient's autonomy while prioritizing safety. Explanation. This scenario presents a professional challenge due to the conflict between a patient's expressed wishes and the FNP's clinical judgment regarding the best course of treatment, compounded by the patient's vulnerability due to their cognitive status. The FNP must navigate the ethical principles of autonomy, beneficence, and non-maleficence, while adhering to legal and regulatory requirements for patient care and decision-making. The patient's daughter's involvement adds another layer of complexity, requiring the FNP to assess the daughter's authority and the validity of her concerns. The correct approach represents best professional practice because it prioritizes patient safety and well-being while respecting the patient's right to self-determination to the extent possible. Obtaining informed consent, even from a patient with diminished capacity, is a cornerstone of ethical medical practice. When a patient's capacity is questionable, a formal capacity assessment is crucial. If the patient is deemed to have capacity, their decision, even if it differs from the FNP's recommendation, must be respected, provided it is informed. If capacity is lacking, the FNP must then engage with the legally authorized surrogate decision-maker, ensuring their decisions align with the patient's known wishes or best interests, as per state and federal regulations governing patient rights and surrogate decision-making. This approach upholds the FNP's duty of beneficence by seeking the safest and most effective treatment, while also respecting the patient's autonomy and the legal framework for decision-making. An incorrect approach that involves overriding the patient's expressed wishes without a formal capacity assessment and a clear determination of lack of capacity would be a violation of patient autonomy and potentially state laws protecting patient rights. Proceeding solely based on the daughter's insistence without verifying her legal authority or the patient's actual wishes would be a regulatory failure, potentially leading to legal repercussions and a breach of professional ethics. Another incorrect approach would be to dismiss the daughter's concerns entirely without a thorough evaluation of the patient's condition and the potential risks associated with the patient's preferred treatment, which would fail the principle of beneficence and could lead to patient harm. The professional decision-making process for similar situations should involve a systematic approach. First, assess the patient's capacity to make informed decisions. If capacity is present, engage in shared decision-making, respecting the patient's choices. If capacity is questionable or absent, initiate a formal capacity assessment. Concurrently, identify and verify the legally authorized surrogate decision-maker. Engage with the surrogate, providing them with all necessary information to make decisions based on the patient's known wishes or best interests. Document all assessments, discussions, and decisions thoroughly. Consult with colleagues, ethics committees, or legal counsel when complex ethical or legal issues arise. Question 16. The evaluation methodology shows that a family nurse practitioner, FNP, is managing a patient presenting with new onset of dizziness, nausea, and fatigue. The patient reports taking several prescription medications for chronic conditions, as well as a new over-the-counter herbal supplement. Which of the following approaches best reflects the FNP's professional responsibility in assessing and managing this situation, considering potential adverse drug reactions and interactions? Option A. Immediately discontinue all prescription medications and the herbal supplement to rule out any drug-induced cause. Option B. Advise the patient that these symptoms are likely unrelated to their medications and encourage them to rest. Option C. Conduct a thorough medication reconciliation. Assess the patient's current symptoms in the context of known adverse drug reactions and potential interactions with all substances the patient is taking, and develop an evidence-based management plan. Option D. Rely solely on the patient's description of their symptoms and their belief about which substance might be causing them. Correct answer is C. Conduct a thorough medication reconciliation. Assess the patient's current symptoms in the context of known adverse drug reactions and potential interactions with all substances the patient is taking, and develop an evidence-based management plan. Explanation. The evaluation methodology shows that a family nurse practitioner, FNP, must navigate complex patient scenarios involving adverse drug reactions and interactions, requiring a deep understanding of pharmacology, patient history, and current clinical guidelines. This scenario is professionally challenging because it demands immediate, accurate assessment and intervention to prevent patient harm, while also considering the patient's overall health status and potential for polypharmacy. The FNP must balance the benefits of prescribed medications against the risks of adverse events and interactions, often with incomplete information or rapidly evolving symptoms. The correct approach represents best professional practice because it prioritizes patient safety through a systematic and evidence-based process. This involves a thorough patient assessment, including a detailed medication reconciliation, identification of potential drug-drug, drug-food, and drug-herb interactions, and a comprehensive review of the patient's symptoms in relation to known adverse drug reactions. The FNP then uses clinical judgment, informed by current FNP scope of practice regulations and evidence-based guidelines for managing adverse drug events, to develop a safe and effective treatment plan. This plan may include discontinuing or adjusting medications, initiating supportive care, and educating the patient. This aligns with the FNP's ethical and legal responsibility to provide competent and safe patient care, as mandated by state nursing practice acts and professional standards. An incorrect approach that involves immediately discontinuing all medications without a thorough assessment is professionally unacceptable. This fails to adhere to the principle of do no harm by potentially causing withdrawal symptoms or exacerbating underlying conditions. It also violates regulatory requirements for evidence-based practice and individualized patient care, as medication management must be tailored to the specific patient and their clinical presentation. Another incorrect approach, such as relying solely on patient self-reporting without independent verification or clinical assessment, is also professionally unacceptable. This overlooks the possibility of misinterpretation, memory lapses, or the influence of other factors on the patient's reported symptoms. It neglects the FNP's responsibility to conduct a comprehensive clinical evaluation and could lead to misdiagnosis and inappropriate treatment. A third incorrect approach, which is to dismiss the reported symptoms as unrelated to medication without further investigation, is professionally negligent. This demonstrates a failure to consider all potential causes of a patient's distress and can lead to delayed diagnosis and treatment of serious adverse drug reactions or interactions. It contravenes the FNP's duty to thoroughly investigate patient complaints and adhere to a systematic diagnostic process. The professional decision-making process for similar situations should involve a structured approach. 1. Recognize and validate the patient's reported symptom. 2. Conduct a comprehensive medication reconciliation, including prescription, over-the-counter, and herbal supplements. 3. Perform a thorough physical and psychosocial assessment. 4. Utilize evidence-based resources to identify potential adverse drug reactions and interactions relevant to the patient's current medications and symptoms. 5. Formulate a differential diagnosis, considering both drug-related and non-drug-related causes. 6. Develop and implement a patient-centered management plan, which may involve medication adjustments, supportive care, further diagnostic testing, and patient education. 7. Document all findings, interventions, and patient responses meticulously. Question 17. Governance review demonstrates that a family nurse practitioner, FNP, is managing a patient with well-controlled type 2 diabetes mellitus who has recently missed 2 scheduled follow-up appointments and has not refilled their metformin prescription in over 3 months. The FNP has reviewed the patient's electronic health record and notes no acute complaints documented in the last visit. What is the most appropriate best practice approach for the FNP to take in managing this situation? Option A. Refer the patient to an endocrinologist for further management, as missed appointments and medication non-adherence suggest a need for specialist intervention. Option B. Immediately prescribe a new metformin prescription and instruct the patient to pick it up at the pharmacy, assuming they will resume taking it. Option C. Document the missed appointments and medication non-adherence in the patient's chart and wait for the patient to initiate contact for a future appointment. Option D. Schedule a telehealth appointment to discuss the patient's adherence to their medication, explore potential barriers to attending appointments, and collaboratively reassess their current diabetes management plan. The correct answer is D. Schedule a telehealth appointment to discuss the patient's adherence to their medication, explore potential barriers to attending appointments, and collaboratively reassess their current diabetes management plan. Explanation. This scenario presents a professional challenge due to the need to balance patient autonomy with the FNP's responsibility to ensure safe and effective management of a chronic endocrine disorder. The FNP must consider the patient's understanding of their condition, their ability to adhere to treatment, and the potential consequences of suboptimal management, all within the scope of FNP practice as defined by U.S. state regulations and professional nursing standards. Careful judgment is required to avoid paternalism while ensuring the patient receives appropriate care. The correct approach represents best professional practice because it prioritizes a collaborative and patient-centered strategy. By engaging the patient in a discussion about their current management plan, exploring barriers to adherence, and assessing their understanding, the FNP is upholding ethical principles of beneficence and respect for autonomy. This approach aligns with the American Nurses Association ANA Code of Ethics, which emphasizes the nurse's role in advocating for patients and promoting their self-determination. Furthermore, it adheres to the Nurse Practice Act of most U.S. states, which grants FNPs the authority to assess, diagnose, and manage chronic conditions, including endocrine disorders, in collaboration with the patient. This involves educating the patient, developing a shared treatment plan, and establishing appropriate follow-up. An incorrect approach that involves unilaterally adjusting medication dosages without further discussion or assessment fails to respect patient autonomy and may lead to non-adherence or adverse effects. This could be considered a violation of ethical principles and potentially a breach of professional standards of care, as it bypasses the essential step of understanding the patient's perspective and current challenges. Another incorrect approach, such as referring the patient to an endocrinologist without first attempting to understand and address the patient's current management issues, could be seen as an abdication of the FNP's primary responsibility for managing this chronic condition. While collaboration with specialists is important, it should not replace the FNP's role in ongoing patient care and problem solving, especially when the issue appears to be related to adherence or understanding rather than a need for highly specialized intervention. This could be viewed as a failure to provide comprehensive care within the FNP's scope of practice. Finally, an approach that involves documenting concerns without initiating a dialogue with the patient or developing an action plan is insufficient. While documentation is crucial, it must be accompanied by appropriate clinical action to address identified issues. This passive approach fails to meet the professional obligation to actively manage patient care and promote positive health outcomes. The professional decision-making process for similar situations should involve a systematic approach. First, assess the patient's current status and understanding. Second, identify any barriers to effective management. Third, engage the patient in a collaborative discussion to develop a mutually agreeable plan. Fourth, implement the plan and establish clear follow-up. And fifth, document all assessments, interventions, and patient responses. This process ensures that care is both clinically sound and ethically responsible, respecting the patient's rights and promoting their well-being. Question 18. The risk matrix shows a moderate risk of adverse drug events for a patient with multiple comorbidities and polypharmacy. Which of the following actions best reflects evidence-based prescribing in this scenario? Option A. Continuing all current medications as prescribed by previous providers, assuming they are appropriate for the patient's current condition. Option B. Initiating a new medication based on a single promising study published in a high-impact journal, without a comprehensive review of the patient's existing regimen. Option C. Prescribing a medication with a known higher risk of side effects, but a potentially faster onset of action, without discussing alternative options with the patient. Option D. Reviewing the patient's current medication list, for potential interactions and titrating dosages based on current clinical practice guidelines and patient response. The correct answer is D. Reviewing the patient's current medication list for potential interactions and titrating dosages based on current clinical practice guidelines and patient response. Explanation: the risk matrix shows a moderate risk of adverse drug events for a patient with multiple comorbidities and polypharmacy. This scenario is professionally challenging because the FNP must balance the need to manage complex health conditions with the inherent risks associated with prescribing multiple medications. Careful judgment is required to select evidence-based treatments that are both effective and safe, minimizing the potential for drug interactions and side effects. The correct approach represents best professional practice because it prioritizes patient safety and adherence to established guidelines for evidence-based prescribing. This involves a thorough review of the patient's medical history, current medications, and relevant clinical guidelines. It also necessitates open communication with the patient to ensure understanding and adherence to the treatment plan. This aligns with the FNP's ethical and legal responsibility to provide competent and safe care, as mandated by state nurse practice acts and professional nursing standards, which emphasize the use of current evidence to guide clinical decisions. An incorrect approach that involves prescribing a new medication based solely on a single recent clinical trial without considering the patient's individual circumstances or potential drug interactions would be a regulatory and ethical failure. This disregards the principle of individualized care and the requirement to integrate research findings with clinical expertise and patient values. Another incorrect approach, such as continuing a medication that has shown limited efficacy or has a high risk of adverse effects for this patient, simply because it has been prescribed in the past, fails to uphold the standard of care and the obligation to reassess and adjust treatment based on current evidence and patient response. This could lead to suboptimal outcomes and potential harm, violating the FNP's duty of care. Professionals should use a decision-making framework that begins with a comprehensive patient assessment, including a detailed medication reconciliation. This is followed by a critical appraisal of available evidence, considering the strength of the evidence, its applicability to the specific patient, and potential risks and benefits. Consultation with pharmacists or other healthcare providers may be beneficial. Finally, shared decision-making with the patient, incorporating their preferences and values, is crucial in developing a safe and effective prescribing plan. Question 19. The performance metrics show a slight but consistent decline in the identification of patients at high risk for type 2 diabetes within the FNP's primary care practice over the last 2 quarters. What is the most appropriate next step for the FNP to take in addressing this trend? Option A. Reevaluate the performance metrics themselves to determine if the data collection methodology is flawed, without considering the clinical implications of the observed trend. Option B. Immediately implement a new, widely publicized diabetes screening campaign for all patients over the age of 18, regardless of their individual risk factors. Option C. Conduct a detailed review of the current risk assessment protocols for type 2 diabetes, examining patient selection criteria, screening tool utilization, and documentation completeness, in conjunction with analyzing patient demographics and prevalent comorbidities within the practice. Option D. Focus solely on increasing the number of HbA1c tests ordered for all patients, assuming this will indirectly identify more at-risk individuals. The correct answer is C. Conduct a detailed review of the current risk assessment protocols for type 2 diabetes, examining patient selection criteria, screening tool utilization, and documentation completeness, in conjunction with analyzing patient demographics and prevalent comorbidities within the practice. Explanation: this scenario presents a professional challenge because the FNP must interpret performance metrics that indicate a potential gap in advanced health assessment, specifically in risk assessment, without resorting to simplistic or incomplete data analysis. The FNP's role requires a nuanced understanding of patient populations and the factors contributing to health risks. Careful judgment is needed to move beyond raw data to actionable insights that improve patient outcomes and align with professional standards of care. The correct approach represents best professional practice because it involves a systematic and comprehensive review of the performance metrics in the context of the FNP's patient population and the established regulatory framework for advanced practice nursing. This includes considering demographic data, common health conditions within the practice, and the specific risk assessment tools and protocols currently in use. By analyzing trends and identifying specific areas where risk assessment may be suboptimal, the FNP can then develop targeted interventions, such as enhanced screening protocols, patient education initiatives, or further professional development. This aligns with the FNP's responsibility to provide evidence-based, patient-centered care and to continuously improve the quality of services. As mandated by professional nursing standards and state-specific nurse practice, acts which outline the scope of practice for FNPs, including the requirement for comprehensive health assessments and risk identification. An incorrect approach that focuses solely on the number of screening tools administered without considering the appropriateness or completion of those screenings fails to meet professional standards. This approach is flawed because it prioritizes quantity over quality and clinical relevance. Ethically, it neglects the patient's individual needs and the principle of beneficence, as an incomplete or inappropriate screening does not contribute to their well-being. Regulatory failure occurs because it does not adhere to the requirement for thorough and accurate health assessments, potentially leading to misdiagnoses and suboptimal care, which could be a violation of the Nurse Practice Act's provisions regarding competent practice. Another incorrect approach that involves immediately implementing new, unvalidated screening tools without a thorough risk-benefit analysis or consideration of the existing patient population's needs is also professionally unacceptable. This approach is problematic because it can lead to unnecessary patient burden, increased healthcare costs, and potential for false positives or negatives, undermining patient trust and the principle of non-maleficence. It also bypasses the established process for evaluating and integrating new clinical practices, which often requires evidence of efficacy and safety, and may not align with organizational policies or regulatory guidelines for adopting new clinical interventions. A third incorrect approach that involves generalizing the performance metrics to the entire patient population without stratifying by age, chronic condition, or other relevant risk factors is also a failure in professional reasoning. This broad generalization overlooks the diverse needs and varying risk profiles within the patient population. Effective risk assessment requires a tailored approach, recognizing that different individuals and subgroups face different health challenges. Failing to stratify data can lead to misallocation of resources and ineffective interventions, thereby not upholding the FNP's duty to provide individualized care and potentially violating the ethical principle of justice by not addressing the specific needs of all patient groups equitably. The professional decision-making process for similar situations should begin with a clear understanding of the performance metrics and their potential implications. The FNP should then contextualize these metrics within the specific patient population served, considering demographic factors, prevalent health conditions, and existing assessment protocols. A critical evaluation of current practices, including the appropriateness and effectiveness of existing risk assessment tools, is essential. This should be followed by a review of relevant professional guidelines and regulatory requirements. Based on this comprehensive analysis, the FNP can then identify specific areas for improvement and develop targeted evidence-based interventions. This iterative process of assessment, planning, implementation, and evaluation is fundamental to providing high-quality, ethical, and legally compliant advanced practice nursing care. Question 20. Quality control measures reveal that a community-based diabetes prevention program implemented by an FNP has had high initial enrollment. To assess the program's true effectiveness and identify areas for improvement, which of the following evaluation approaches would best demonstrate adherence to best practices in health promotion and disease prevention? Option A. Reviewing the number of participants who attended at least 80% of the program sessions and gathering testimonials from those who found the program helpful. Option B. Analyzing changes in participants' HbA1c levels, blood pressure, and body mass index over time, alongside collecting data on participant satisfaction and adherence to lifestyle recommendations. Option C. Implementing a new, similar program in a neighboring community based on the initial enrollment success, without further evaluation of the original program's outcomes. Option D. Conducting a survey of community leaders to gauge their perception of the program's impact on community health awareness. The correct answer is B. Analyzing changes in participants' HbA1c levels, blood pressure, and body mass index over time, alongside collecting data on participant satisfaction and adherence to lifestyle recommendations. Explanation. Scenario analysis. This scenario presents a common challenge in primary care where a family nurse practitioner, FNP, must evaluate the effectiveness of a health promotion program. The challenge lies in discerning which approach to program evaluation aligns best with evidence-based practice and regulatory expectations for patient care quality, ensuring that interventions are not only implemented, but also demonstrably beneficial and ethically sound. Correct approach analysis. The correct approach involves a systematic review of patient outcomes data, comparing pre- and post-intervention health metrics, and incorporating patient-reported satisfaction and adherence data. This aligns with the FNP's responsibility under the Nurse Practice Act, assuming a U.S. jurisdiction for this exam, to provide competent, evidence-based care. Regulatory bodies and professional organizations emphasize outcome-driven quality improvement, requiring practitioners to demonstrate the efficacy of health promotion initiatives. This method ensures that the program is not just a procedural checklist, but a dynamic intervention that positively impacts patient health and well-being, adhering to ethical principles of beneficence and non-maleficence. Incorrect approaches analysis. One incorrect approach focuses solely on program participation rates without assessing health outcomes. This fails to meet the FNP's obligation to ensure patient benefit, as high participation does not guarantee improved health. Ethically, it risks resource allocation to ineffective programs, violating principles of stewardship and responsible practice. Regulatory failure lies in not demonstrating measurable improvements in population health, a key metric for quality assurance. Another incorrect approach relies on anecdotal feedback from a small, self-selected group of participants. This is methodologically flawed and does not represent the broader patient population. It lacks the objectivity required for evidence-based practice and can lead to biased conclusions, potentially masking program deficiencies. This approach fails to uphold the FNP's duty to provide care based on reliable data, a cornerstone of professional accountability. A third incorrect approach involves implementing a new, unproven intervention based on a single, recent publication without considering the local patient population's specific needs or existing evidence. This disregards the need for critical appraisal of research and adaptation to context, which is a professional and ethical imperative. It also bypasses the systematic evaluation required to ensure the intervention is safe and effective for the intended recipients, potentially leading to harm and violating the principle of non-maleficence. Professional reasoning. FNPs should employ a structured approach to program evaluation. This involves defining clear, measurable objectives for the health promotion program, selecting appropriate metrics to assess progress towards these objectives, collecting data systematically and objectively, and analyzing the data to determine program effectiveness. This process should be iterative, allowing for program modification based on findings. Professionals must consult relevant professional guidelines and regulatory standards to ensure their evaluation methods are robust and compliant. When faced with evaluating health promotion initiatives, the decision-making process should prioritize patient outcomes, evidence-based methodologies, and ethical considerations of patient welfare and resource utilization.